Hello, this is Maddie. This is Module 11. Um, Within the opioid crisis, there has to be people there to take care of those who face addiction issues. People in lower economic households are more likely to overdose from opioids, and I believe that poverty and addiction coincide with each other. Women also make less than men, so they are more likely to be in poverty and struggle with addiction issues. Women are also more likely to work in the healthcare field than men and help with those that struggle with addiction directly. In the article, they described deaths of despair as overdoses that happen from opioids in rural communities. Peter Zadol's piece writes about how after fentanyl gained popularity, hospitals and other public resources, people with addiction issues became overfulfilled. This widespread addiction puts a burden on the community and its workers, as well as the families that have to struggle with addiction as well. The opioid crisis directly affects people in poverty and the public service workers in it, both of which are more likely to be women. The opioid crisis, specifically fentanyl, is destroying impoverished communities and the public healthcare system that has been overwhelmed for a while. I have seen within my own community people's parents not be there for them because they are struggling with addiction. Women are the caregivers and breadwinners in their family within impoverished communities in most instances. On top of caring for their children, some women have to care for their loved ones that battle addiction. These women have multiple roles as well as struggle with addiction themselves. There were multiple groups that were at risk for developing an opioid addiction: people in low economic groups, people who have a chronic disability, and other risk factors. Other indicators that were stated about people in low economic groups is that because they make less, they have lower self-esteem. They then use drugs to escape the feeling of low self-esteem or use drugs to escape the fact that they are impoverished. With people who have a chronic disability, they are at risk because they get prescribed these opioids and are not always told exactly what the drug does. Graham and Parker stated that the group with the highest risk of opioid addiction was middle-aged men with a disability. The authors identify that having a disability is an indicator because often opioid addictions start as a prescription for pain management. When we know about these factors that might indicate addiction, we can help set up safety nets around these drugs because we know that these groups are more prone to addiction. Also, getting ahead of the problem and talking to these groups directly about what the addiction is like can help mitigate any future questions. It makes sense that people with chronic disabilities struggle with opioid addictions more than any other group because of the overprescribing of opioids to that group. I believe that there is a severe lack of information about how opioids affect people and can make them addicted. If we can identify what group struggles with this addiction the most, then we can provide information as well as set up safety rails for the drug. The type of group that is affected by opioid addiction is also dependent on the type of opioid that it is. There has been a major push by pharmaceutical companies to prescribe opium to people and tell them the addictiveness of it so that they can gain capital. The outcome of this major push of these drugs is major addiction within middle-aged, chronically disabled people. According to the CDC, in 2023, almost 80,000 people died from opioid overdose. Overprescribing has a deadly effect on everyday Americans. That is because the reality of opioids was kept a secret from the public, which has created addictions that people did not realize they even had. Uh, Davis states that the deadly transformation started when pharmaceutical companies started lying to doctors and patients about the addictiveness of opioids. These pharmaceutical companies push for opioids to be overprescribed to patients, causing the addiction rate for opioids to rise. The large lack of information to the public about how opioids affect the body greatly contributed to the spread of this drug because most of the time people got this drug from their doctors. These companies knew that if they lied to these doctors, they would get instant addicts because they are supposed to be trusted health sources. The opioid crisis is still greatly affecting people because of the misinformation that the pharmaceutical companies spread about opioids to the public. Many people still struggle with substance abuse with opioids because of how easily accessible some opioids are, and relapse rate is high. Opioids were supposed to be something that people used when they were in pain, but because of corporate greed, it gets abused. Opioid addiction is one of the biggest issues facing America because it kills, and it does not just affect the user. Jan Rader has developed several strategies that reduce the rate of overdosing again after the initial response. Jan has stated that it started when she was observing and testing out different ways to speak to people she was assisting in recovering from an overdose. She stated that the opioid crisis had affected her community greatly, and she knew it was a greater issue than just responding to the overdose. She stated that initially the overdose response was abrasive because it did not have the people struggling with these substance abuse issues in mind. Jan states that after she started responding differently, she noticed the needs of the people who were struggling with addiction outside of the initial overdose. She says that now, after responding to the overdose, a team of people go and see the person to help them further. Her community has also started a clinic that specializes in substance abuse issues and has specialists in substance abuse rehabilitation. Overall, several outreach programs have helped with substance abuse outreach and the system of patient care. Some other settings that I could see Jan's programs being useful are within the police force. One of the programs that Jan started was the first responder mental health program that lets them decompress the trauma they go through that comes with the job. I think that police officers could use this resource because so many of them deal with mental health related issues due to their job. I also think that after the police are contacted, there should be a follow-up response team to see if you need further assistance. Also, people can help by being proactive in their community and doing things when you see that someone needs help. Bad things can happen when you just stand by. Men are more likely to be substance abusers of opioids because they are more likely to get prescribed opioids for pain. Addiction affects the people around you, and if you are a middle-aged man, you most likely have a family, so an opioid addiction would disrupt many people's lives. I think women are more likely able to maintain their drug habit and keep up with their social responsibilities than men are able to, but that is not to say that one drug user is better than the other. Men and women's drug habits are different, and it manifests differently because they are socialized differently. In the Gran and Parker article, they stated that most of the substance abusers of opioids they surveyed were men. In the Peters et al. Article, they stated that the opioid crisis overflows the public service sectors of the government, making it harder to help other people. In the Peters et al. Article, they also stated that impoverished people are more likely to struggle with opioid abuse issues. Jan spoke in her TED Talk about how opioid crisis has affected her community and changed the lives of the people she has seen affected by it. Addiction, no matter what kind, affects everyone around you, so no matter your gender, addiction hurts people. Men in their middle ages who are lower income are more likely to become addicted to opioids than women now, and it affects people in their lives equally. When I looked up how the opioid crisis is currently affecting the United States, it stated that it is currently costing us $2.7 trillion to our economy. The crisis does not just affect people, but also the institutions around us like capitalism. It is interesting because the reason for the opioid crisis is capitalistic gain from pharmaceutical companies, and now the people affected by it cannot participate in capitalism. Thank you.